viewers and learners of the Postgraduate Diploma in Environmental and Occupational Health. Welcome to this session for the course MEVE 002, that is Healthcare. Today in this session, we will discuss about overview of infectious hazards in the healthcare settings. Now you have often seen that many of the people who are working in the healthcare settings, they are exposed to several hazards. This could be the physical, the chemical, the biological hazards, and in this session we will be discussing about some of the biological hazards which are really infectious in nature and which are transmitted to the healthcare workers. This could be from the patients to the doctors, to the nurses, to the ward boys and so on. Right? So after listening to this module, you will be able to understand some of the infectious hazards, that is the hazards which are faced in the healthcare settings, and some of the management and the prevention that could be done by these people who are working in such settings. Hospitals, as we all know, these are the breeding ground for some of the harmful microorganisms, and these pathogenic organisms, they may be hiding anywhere in the hospital. So they could, for example, they could be in the air, and these examples could be like the tuberculosis bacteria, or they could also circulate in the blood of some of the patients who are admitted there. You could also have the hepatitis B or the C virus, which can be transmitted to the healthcare workers through even the needle prick injuries. So almost all the people who are involved in the patient care, either directly or indirectly, they are at a certain risk of acquiring these infections. So in these hospitals, one may be directly involved with the patient care when they, for example, the doctors or the nurses, they are directly interacting with the patients and they may be administering the drugs, they may be checking the patients and so on. Now there are also the other category of the people or the staff in the hospitals, like those who are working in the laundry sector. So they are dealing with the clothes that are used by the patients, or the towels or the bed sheets that are used on those maybe in the critical care or the intensive care sectors. And again you find the people who are working in the pharmacy, who are providing the drugs, the antibiotics for the patients and so on. So doctors and nurses, they are coming in direct contact, so they are at a more risk of acquiring such infections. The second is the OPDs can also be contaminated, so these also have to be regularly sanitized and the air has to be pure, so that those patients who are entering the OPDs, they are not infected by the infections or the infectious diseases. The same way pharmacists, ward boys, so there are so many people who are at risk in the healthcare settings. So the healthcare workers are also at a high risk of exposure to the blood and the body fluids. And many of the injuries, like for example, they can have cuts or the splashes which can come from chemicals or from some other agents, then the needle stick injuries, then there can be some common occupational accidents. These are all exposing these healthcare providers to different blood-borne pathogens also. Now the transmission of hepatitis B virus, the human immunodeficiency virus, and also the hepatitis C virus, all this has been related to injuries and the frequency of exposure to. The World Health Organization, they reported in the year 2002 in the World Health Report, it's quite a few years back, that 35 million health workers and 2 million of them, they experience the percutaneous exposure to infectious diseases every year, that is annually. And among this, 37.6% approximately, this include that of the hepatitis B virus, 39% of hepatitis C, and 4.4% of the HIV and the AIDS in the healthcare workers. This is globally, and these are all, they report that it is due to the needle stick injuries. And also there have been these scientific studies which have shown that adherence to the standard precautions and awareness about the post-exposure prophylaxis is poor in the developing countries, mostly among the healthcare workers. Therefore, detection, treatment and prevention of the hospital-acquired infections in the healthcare workers, this is very important because such infections may be life-threatening, as these causative organisms are mostly resistant to the antimicrobial agents. And they may also act as a reservoir of infections and act as a continued source of infection to the patients and other staff in their contact. Now in this session, we will also learn about the various pathogens, right? We will learn about some of the important pathogens that are found in the healthcare settings, the mode of transmission of these organisms, whether it is absorption, inhalation and so on, and also some of the harmful effects that they have on the healthcare workers. You will also understand about the precautionary measures to be taken by the hospital staff and management in order to protect themselves and also the patients. Now let us now list some of the common infections that are acquired by the hospital staff. First, it could be diarrhea that is caused by the enterococci, tuberculosis, the hepatitis B virus, hepatitis C virus, staphylococcal infections, pneumonia and human immunodeficiency virus, which are to be listed as some of them. Now the exposure to the infectious agents. So the healthy people are also contaminated with such infectious agents. Our tissues and organ systems, they could be contaminated with these microorganisms. So there exists a symbiotic relationship between these organisms and also the human body, and these are known as the commensals. Whether a tissue will develop an infection after exposure or contamination, this depends on the interaction between the contaminating organism and also the host. The healthy individuals, they will have normally a general resistance to some of the infections. But the people who have an underlying disease and the newborn infants and the elderly, okay, they have less resistance and they will be vulnerable, and probably they will develop some sort of an infection after exposure or contamination. Therefore, local resistance of the tissue to infection, this also plays an important role. The skin, the mucous membrane, they can act as barriers for the pathogenic organisms, and infections can follow when these barriers are breached. The most important determinants of infection, however, these are the nature and the number of the contaminating organism. For example, if we have to explain this, I can say that when there are only a few organisms are present in a tissue, an infection will not necessarily develop. But when you have a critical number is exceeded, then it is very likely that the tissue can become infected. Therefore, for every type of microbe, the minimal infective dose can be determined, and this is the lowest number of the bacteria, the viruses or the fungi that can cause the first clinical signs of infection in any healthy individual. Now let us go on to the routes of transmission. So microorganisms, when we say, they can be transmitted from their host to a new host through direct or through indirect contact. It could be through the air or also by the vectors. The healthcare setting. So this is one of the main sites of transmission of the blood-borne infection. So we keep on hearing about the dreaded stories of transmission of HIV or HBV by the needle prick injuries, and recently we have also witnessed this pandemic of the coronavirus. Earlier, through the blood transfusion, many of the infectious agents were transferred from the infected person to a patient. And there is also the vector-borne transmission, which is typically transmitted by the insects, the arthropods and also certain parasites. So these they can become contaminated by contact with the excreta or the secretions from an infected patient, and they transmit these infective organisms mechanically to the other patients. Some vectors like the mosquito bites, they can bite individual and then they can transmit the pathogen. In the same way, airborne transmission that can occur with the microorganisms that are dispersed into the air. Now these are dispersed in large numbers because of sneezing or even of the coughing. Direct contact with the patients is also one factor. Indirect contact through fomite is also very common in the healthcare settings. Now this is a table which is showing you some of the routes of infection. For example, the skin, inhalation, through ingestion and through the needle prick injuries and contact with the infected body fluids. So if you see in the skin, it can cause the severe skin infection like the cellulitis, and that could be caused by the MRSA, that is a methicillin resistant Staphylococcus aureus, and also the vancomycin resistant enterococci. In the same way, inhalation, you can have the various acute and chronic infections of the respiratory tract infections, which is caused by the varicella, then Klebsiella pneumoniae and so on. Then ingestion, that could be due to the E. coli and the Salmonella typhi and also Clostridium species, Campylobacter species, and they can cause severe diarrheas, typhoid, jaundice and so on. The needle prick injuries. Here again, the disease that is caused, that could be the AIDS, the T-cell lymphoma and the hepatitis. and the causative organisms could be the hepatitis B virus, the hepatitis C virus, HIV, HTLV and so on. Now let us go on to the specific type of the infections. The first we will cover is the airborne infection. Now when any infected person, he coughs or he sneezes, these organisms are coming out of the body from his nose or through his mouth, which is not covered. So these organisms and these droplets, when they come out, they will evaporate. They can also settle on to certain surfaces. And that droplet nuclei, let us say that the size is usually from 1 to 5 micron. They can be suspended in the air for long periods. So such airborne transmissions, they can occur when even such evaporated droplet nuclei, which are less than 5 micron in size, they are disseminated into the surrounding air. Now the droplets can also be generated during the medical procedures like the tracheal suctioning. Diseases which are spread by this mode, they can also include the pulmonary tuberculosis, measles, chickenpox, severe acute respiratory syndrome, that is SARS, bird flu, pneumonia and so on. Coming on to the next one, that is the tuberculosis, or we call it as TB. This is a serious public health problem in many of the developing countries. And let me tell you, even the multi-drug resistant TB is also causing a lot of concern among the people, especially in the developing countries. So India accounts for nearly a fourth of all the new TB cases that are detected worldwide. And the mode of transmission of this bacteria is through the droplet nuclei. The bacteria exit through the nose when the TB patient coughs or he sneezes. And the healthcare workers who are working in the chest OPD and the indoor environments, they are at the highest risk of getting such TB infection. Ideally, the active pulmonary tuberculosis cases, they normally are kept in isolation, and the room should be well ventilated, but in the overcrowded and the public health facilities, sometimes these are not possible all the time. As a result, the healthcare workers readily get such kind of a TB infection. Now with the rising cases of the multi-drug resistant TB, that is MDR TB, the situation is more complex presently. The next one is a meningococcal meningitis. This is also caused due to a bacterial infection, and once admitted, the patient of meningitis due to the meningococcus is infectious to the others until some kind of an antibiotic is started on him. So, such patients should be put promptly on an effective antibiotic drug. Otherwise, the healthcare workers who are coming in close contact, respiratory contact with such cases, they should also receive some kind of chemoprophylaxis. The healthcare workers should avoid the close respiratory contact with such patients. Coming on to the severe acute respiratory syndrome, or SARS. This first appeared in 2002 in China, and it spread rapidly worldwide within a few months. And this is a viral transmission. It is a viral respiratory disease of zoonotic origin. It is caused by the SARS coronavirus. Now we are all very much familiar with this because in all the countries this was a pandemic, and globally we all experienced the asymptomatic or the symptomatic forms of the coronavirus. And even now presently in the year 2021, we have now a new variant, the Delta variants, and also the Omicron variants, which are coming daily in your newspapers, and we are getting to know more of this from the genome sequencing that is being done in the several laboratories worldwide. So this also, it is transmitted through the droplets that enter the air when someone with the disease coughs, sneezes, or he even talks. Fever, dry cough, headache, the muscle ache and difficulty in breathing, these are some of the very common symptoms. Treatment is nothing but supportive care. Bird flu, this is also referred to as the avian flu, the avian influenza, H5N1 and H7N9. So the bird flu viruses, they infect the birds, including chickens and other poultry and wild birds such as ducks. Usually the bird flu viruses, they infect only the birds. Rarely the humans are affected. And there are two types, that is the H5N1 and H7N9, and of course we have some more variants. They have infected some people during the outbreaks in Asia, Africa and Pacific, the Middle East and also parts of Europe. So most of the people who get the bird flu, normally they are in close association, they have come in close contact with the infected birds or their droplets or the surfaces that have been contaminated, even the egg surfaces, by the bird's saliva, the mucus material or its droppings. So it is also possible to get this by breathing in the droplets or the dust that contains the viruses. Rarely the virus has spread from one person to another, or human to human transmission has occurred. The symptoms also are mild to severe, and they are similar to the seasonal flu, such as the fever, the cough, sore throat, a runny nose or stuffy nose. They can have muscle and body aches, fatigue and headaches, conjunctivitis and also dyspnea. In some cases, the bird flu can cause serious complications and even death, and some people are at very high risk for the serious illnesses. They include the vulnerable people, which we even discussed before in the previous slides. They include the pregnant women, people with a weakened or less immune or weakened immune systems, and also the elderly and the senior citizens. Treatment is normally with the antiviral medicines that may make the illness less severe, and they may also help prevent the flu in the people who were exposed to it. Currently, the vaccines are still under the trials. Bloodborne infection. The bloodborne infections like the HIV, the HPV and the HCV, they have the potential of transmission related to the type of injuries and also the frequency of exposure to such infections. There is one case of the seroconversion of the HIV or AIDS in over 650 accidents, as opposed to 20 or 30% approximately in the case of the hepatitis B. And this again may be due to the low concentration of HIV in the blood. Human immunodeficiency virus, HIV epidemic. This has forced us to recognize the potential dangers facing the healthcare workers on this job, and it has forced all the healthcare workers to reassess the type of procedures that have to be undertaken by them. It has also highlighted the basic lack of precautions taken in the past regarding the personal safety and also how to halt the transmission of many of the potential pathogens. So this dreaded modern day pandemic that is caused by the HIV, that could be transmitted in the healthcare settings through inoculation injuries from the contaminated needles or exposure of abraded skin or the mucous membrane to the blood or body fluids that are infected by the HIV. Hepatitis virus. So this is an inflammation of the liver that can lead to liver damage and death. It can be caused by a virus which is transmitted through the needle prick, and it is recognized as an occupational hazard also among the hospital personnel, and according to the WHO, the prevalence rate of HPV, it is 3 to 6 times higher in the hospital staff than those of the general populations. The most common mode of the transmission of the HPV, this is the blood. With the advent of the effective and safe hepatitis B virus, the occupational risk of acquiring this infection, it is now greatly diminished in the health facilities, where the healthcare personnel, like for example, they could include the doctors, the nurses, they are given the complete course of vaccination. However, still the risk will not be completely eradicated, and there are concerns of the vaccine failure too. Infections that are acquired through the fomites. A single incidence of hand contact with a contaminated surface, that can also result in a variable degree of pathogen transfers. And some research studies, they have shown that the contaminated hand alone, that can transfer the viruses 5 times or more, or 14 of the other subjects. And that is why even in the corona pandemic, they say that hand washing and sanitization of the hand and covering of your vital, like your nose and your mouth, that is a very important step, that so that this viruses, they cannot be transferred from one person to another. Microorganisms such as the methicillin resistant Staphylococcus aureus and the vancomycin resistant enterococci, they are frequently encountered, and they contaminate the surfaces in the hospitals, because the routine cleaning of the equipment items and high touch surfaces, they do not always remove such pathogens. So these pathogenic microorganisms, they are capable of surviving for even from days to weeks. The contaminated surfaces, they are frequently touched by the healthcare staff. So therefore, the contamination of the hand, the gloves, or touching of such contaminated environmental surfaces, this is also documented, and that can also lead to the severe skin infections, which we discussed in the table in the few slides before, and that can lead to cellulitis, which is not even responding to some treatments. And the most important thing a healthcare staff can do is to reduce the fomite transmission, is to wash his hands frequently. Healthcare waste. So far we discussed about all the infectious pathogenic agents and how they can be transmitted to the healthcare workers. Now we discuss about the waste that is generated in the healthcare settings, and that is also a reservoir of pathogenic microorganisms, and that can also give rise to several of the infections. So if this waste it is not managed properly, then these microorganisms, they can be transmitted by direct contact in the air or a variety of the vectors. Infectious waste, they can contribute in this way to the risk of the nosocomial infections, putting the health of the hospital personnel and the patients at risk. The types of the hospital waste. The hospital or any healthcare setting, they are generating a lot of waste, and almost 85% of them, these are non-infectious in nature. All the waste generated, they can be divided into several categories. The first is the infectious waste, that is a waste which is contaminated by the blood and other body fluid, for example bandages, gauze or cotton, cultures, stock of the infectious agents from the laboratory work, waste from the patients in the isolation wards and the equipment. Pathological waste, this is coming from the human tissues, the organs, the fluids and also the body parts even after performing surgeries. Sharps like the syringes, the needles, the disposable scalpels and also blades. Chemicals, for example, they are using formaldehyde, solvents that are used for the laboratory preparation, several kinds of disinfectants, heavy metals also that are contained in the medical devices and the batteries. Pharmaceutical waste, you can have the expired, unused and contaminated drugs and the vaccines. Radioactive waste, that is the products that are contaminated by the radionuclides, including radioactive diagnostic materials or the radiotherapeutic materials. Non-hazardous and general waste also are there in the hospital sector, which do not pose any particular biological, chemical or radioactive or even the physical hazard. But again, general waste is also generated in such sectors. Latex allergy. So some of the people have also been complaining of latex allergy, like when they wear the gloves, for example. So this rubber latex, it can be natural or the synthetic ones. The natural rubber latex, it comes from the sap of the rubber tree that is found in Africa and Southeast Asia. Allergic reactions to the products made with the latex, they develop in the persons who become allergic to the proteins contained in the natural rubber latex. In the same way, synthetic rubber is also made from the chemicals. So here again, and especially you would have seen that it is a common component in many of the medical and the dental supplies. They are used in the disposable gloves, in the dental dams, in the airway and the intravenous tubing, syringes, in stethoscopes, catheters, dressings and also the bandages. So when people with the latex allergy, they come into contact with latex, they develop an allergic reactions. Especially during this corona pandemic, you would have seen these reports on the television, and they would have shown how the doctors have been wearing those PPE kits, the gloves and also the mask for long periods of time, for 12 hours and so on, and how many of them have developed these allergic reactions. The infections that are acquired in the operation theatres. So the surgical site or the operation theatres, this is also very common, especially in the developing countries where it is a breeding ground for the infections. Around 2 to 5% of the patients who are undergoing the surgical procedures, they can suffer from the surgical site infections, and they can include significant patient morbidity and mortality and burden the healthcare system with the immense cost. So infections can be acquired through the endogenous organisms present in the patient's own body or through the airborne organisms present in the operation theatres, and these organisms, they originate primarily from the skin and the hair of the individuals in the operating room. The caps, the gowns, the mask, they are all designed to prevent such shedding. The number of persons present in these settings, as well as the level of activity, the type of surgery, the quality of the air provided, the rate of the air exchange, the quality of the staff clothing, the quality of the cleaning process, and the level of compliance with the infection control practices, all can influence the airborne contamination. The common organisms that are associated with the surgical site infections are Staphylococcus aureus, Enterococcus species, and the Escherichia coli. Infections in a critical care unit or the intensive care unit, they can also have serious implications for the patients, because the immunity of these patients who are admitted here, they are already low, and therefore they are at a high level of susceptibility to the microorganisms present in the ICU room. So more than 20% of all the infections acquired in the hospitals are basically from the ICU, and common infections are the urinary tract infections, pneumonia, intravascular infections and surgical site infections due to the devices which are used in the intensive care units. So finally, how do we prevent the infections in the hospital or the healthcare settings? We can prevent the healthy staff of the hospital being infected with a pathogenic organism either by separating the infectious sources from him or cutting off any source of route of transmission. Now usually in a hospital, a highly infectious patient is isolated. They are kept in a separate isolation ward. And great care should be taken in order to protect the healthcare workers from the bloodborne infection and all the objects that come in contact with the patients. They should be considered as potentially contaminated. If any object is disposable, it should be discarded. That too we have to see whether it is biomedical waste or the non-biodegradable, biodegradable, and whether it is hazardous waste. All this has to be segregated and disposed of in the environmentally sound manner. And if it is reusable, if the waste is reusable, then the transmission of the infective agents may be prevented by cleaning, disinfection or sterilization using several autoclaves and other the protocol should be in place. So the essentials of the standard precautions to be used by anyone taking care of the patients in any healthcare setting, that should include hand washing, which is very important, the use of gloves, disposable gloves, mask, eye protection and face shield, which are very important, the gown or the personal protective equipments, and environmental controls also should be in place. So my dear learners, in this session we have given you an overview of the infectious hazardous healthcare waste and how the healthcare workers can be exposed to several of these waste and the contamination and the infectious agents that can come from these settings, and how there are these different infections can also be transmitted from vectors or even from human to human in several places in the hospital itself. It could be from the operation theatres, it could be in the OPDs, or it could be even in the intensive care units. And then we discussed about the several types of waste that are generated in such sectors. Then we also gave you an idea of how the standard precautions need to be in place, and even the legislations also should be properly maintained, and they should be taken into account. And the healthcare workers especially, they should take into account all the precautionary measures, and they should be able to help and safeguard themselves and also give life to our patients. So thank you for your patient listening, and I hope you have had a good understanding of this session.